Welcome to Explain, a series of health education programs published by the Facet Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Facet Injections. Introduction. Many people have pain in their back because of problems with the spine. A facet injection can be effective to help relieve certain types of pain. If your doctor recommends a facet injection, the decision whether or not to have the procedure is also yours. This module will explain the benefits and risks of this procedure. Anatomy. The spine is formed of vertebrae, or small bones. The vertebrae are separated and cushioned by softer discs. This allows the spine to flex and bend. The vertebrae are joined with each other at the facet joints. Nerves pass from the body to the brain through the spine. Nerves carry sensations, including the sensation of pain, to the brain. Pressure on the nerves caused by a bone, ligament, or disc may also cause the sensation of pain. Sometimes the pain is fired from an inflamed facet joint. That pain may be localized to the back or may be felt down the leg. Injections to decrease the inflammation may help with this kind of pain. Facet Injections. A facet injection is made to decrease inflammation and swelling in the affected facet joint. The reduction in swelling may decrease or end the sensation of pain. The medications used will be put inside the joint. A needle is used to deliver the medication. Sometimes this is done under X-ray control. The combination of medications usually consists of two classes of drugs. The first is a numbing medication such as Marcaine to stop the pain. The second is a steroid such as methylprednisolone that decreases swelling. The first medication usually causes the pain to go away for a few hours. Rarely, there may be some numbness or weakness in the legs for a short period. In 24 to 48 hours, the steroid starts to reduce the swelling. This helps to reduce pain further. It is normal for the pain to disappear for a few hours after the injection. It may come back and may last a day or two until the steroid medication begins to work. An injection every 2 to 3 weeks may be needed to achieve long-term relief. If the pain has not improved after 2 to 3 injections, then it may not respond to this type of injection. Facet injections may have to be repeated every few months.
Sponsored by the Facet Education Institute. www.facet-education.com. Over 5,000 videos and interactive tutorials.
The procedure. Before the injection, the skin is disinfected and numbed with local anesthesia so that you will not feel the pain of the facet injection. A minute or so later, the medication is injected with a longer needle directly into the facet joint. This is usually not painful, although it may be uncomfortable. During this part of the procedure, you should let your doctor know if you have any pain, especially in the legs. Pain may mean the needle is touching a nerve. After injection of the medications, the needle is taken out and the procedure is completed. Risks and complications. This procedure is very safe. There are, however, several possible risks and complications. These are unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early. Nerves could be injured during the procedure, but this is extremely rare. Sometimes the covering of the nerves is entered and spinal fluid is withdrawn. This usually does no harm, but patients sometimes develop severe headaches. If this happens, let your doctor know. There is a very small chance that you may experience weakness in your legs and possibly in your arms. However, this is very rare. In very rare cases, infections may occur. Therefore, it is important to report to your doctor any worsening of pain or fever. Rarely, patients may have reactions to the medications. The steroid used could increase the blood sugar in diabetic patients, could accelerate the patient's heart rate, or could increase his or her blood pressure. Allergic reactions could very rarely lead to death. It is therefore very important to inform your doctor about each and every allergy you have, especially drug allergies. Finally, the injection may cause internal bleeding, which puts pressure on the nerves. The chance of this happening is again extremely rare, but if you develop a significant new weakness or a bladder problem, you should tell your doctor. It is also very important to tell your doctor if you are on any blood thinners, such as Coumadin, aspirin, or Advil. This type of medication may have to be stopped for a few days to prevent the risk of severe complications, including paralysis. After the procedure, remember to contact your doctor if you develop any new weakness, any new bladder problems, or any worsening of pain or fever. Because of the temporary weakness after the injection, it is very important to have somebody with you to drive you home. X-rays may be used during this procedure. The amount of radiation during this test is deemed safe. However, this same amount could be dangerous for a fetus. It is therefore very important to make sure you are not pregnant prior to this procedure. Be sure to tell your doctor before the procedure is performed if there is any chance you may be pregnant.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Facet injection is a very safe procedure that can significantly reduce or end your pain. However, as you have learned, complications may happen. Knowing about them will help you and your doctor detect and treat them early if they happen. Thank you for using Explain.